Welcome to the Great Things LLC podcast. I'm your host, Josh Meter. Today I'm talking with Mandi Freger about autism, mental health, counseling, energy therapy techniques in her upcoming book.
Well, it's close to the end of June. I am back from a 2-week road trip, visiting friends and just kind of resetting my energy. And speaking of energy, I am excited to introduce you all to Mandi Freger. Mandi and I have worked together off and on over the last probably 5 years, I guess it's been 5-6 years.
Yeah.
Okay. So Mandi, you have an interesting story in your career because you're in the field of psychology and mental health. You've been very well known for your work with Autism Spectrum Disorder and also some of what people are now discovering as the progressive energy psychology techniques, but you've been doing this for a while. So why don't you share how you started your career, and then we'll go on to where it's taken you.
Yeah, I tend to talk about this a lot, but I think it's really integral to how I practice. And knowing that energy psychology techniques are really the first tools that I clinically learned. And back when I learned them over 20 years ago, that was not common. It was not common. So we're going to talk today about wellness and energy. And I am a believer that if we really are on the path that we're meant to be on and aligned with that mind, body, and soul, that we're fulfilling our mission, whatever that is. And it so happened that I think that this was my mission to get into this field with energy psychology. And I was blessed early on to learn these techniques under one of the leaders in the field at the time, who is Dr. Greg Nicosia, and he's in the Pittsburgh region where we are. And so I remember being really young and learning these techniques, and of course, not really knowing much about them, but they came really easy to me. And he was teaching and training around the country at the time. So he hired me to do some organization with those conferences and to actually do some treatments. And when I would go with him to these seminars, I was finding more and more, because his audiences were getting larger coming to these, that he was letting me assist in teaching some of the seasoned practitioners how to do some of these things. And he was mostly using thought-filled therapy techniques, and he later expanded that onto his own diagnostic level of teaching those techniques. So it didn't occur to me until I was in like these practicums with licensed psychologists and licensed professionals who have been, practicing clinical therapy for so long, that here I am, in my early 20s, teaching them how to do these new techniques that they were, really blown away by. And so that started to kind of put this all, give me a frame of reference to how cool this was and how new these techniques were and progressive. So I learned these techniques first, and then I entered the field of behavioral health for kids and adolescents. And that's when I was introduced to autism. And like a lot of outpatient clinicians today, like I like to teach and train outpatient therapists as a sidebar, to be a little bit braver about working with autism spectrum disorders and families of those diagnosed with these disorders. Because like me back in the day, when I was starting to work with this population, I was like, I'm not so sure. I don't know much about this. This is really specific. These kids are really intense. There's a whole different skill set that I would need to be trained for. I'm not so sure I should be doing this. And they said, yeah, we'll train you. It's fine. So I had a little bit of training, and little did I know I was learning mostly from staff who had other training who I was actually supervising. So they were the ones that taught me so much about direct intervention with these kids in this population. And then later, caregivers were the ones who taught me a lot. So fast forward, I was a manager for a long time in different levels of clinics. I've had experience probably in most of the mental health service lines in Pennsylvania throughout my career. And then I worked intensively at an autism-based, a center-based program, which was a licensed private school and a diagnostic center combined. And this was an initiative by a small hospital system in the area who really, was passionate about bringing these types of services to Pennsylvania. And they looked for it's the Cleveland Clinic's model with their children's hospital, who had a big school and a center-based program. And I remember my CEO at the time was really inspired by that. And so the Cleveland Clinic chose this small hospital system because of the passion that the CEO had to bring this here. So I was the director of that program for 5 years, and that's where, spoiler alert, which I'll talk about in a little bit, right, about how I brought and integrated my knowledge of autism spectrum disorders and energy psychology together.
Okay. And let's dive into that a little bit, because what are the differences with energy psychology techniques and traditional behavioral therapy? So what are the differences, kind of compare and contrast, and then how they actually mesh really well to support one another?
Good. So I'm gonna talk about this like as if we have the little yellow and black book, Therapy for Dummies, and it would be technically theory, right? Theory for dummies. And so this is, let me just say, for graduate students, this is kind of one of the most feared courses, is theory and what techniques to use and how to use them. I shouldn't speak generally, but I remember when I was in school, lots of people were stressing out about it. So traditional, if we take a graduate school textbook about how do we do psychotherapy or, integrative clinical practices, the most traditional, I would say, therapeutic technique that you see, like when you watch TV, even though it's not implemented great all the time, or when you have sort of a thought about what therapy or outpatient therapy might be, probably the most widely used technique is called cognitive behavioral therapy. And this links a little bit with ABA, which is what I do, and I'll talk about that, and then I'll talk about how energy psychology fits into all of this. But cognitive behavioral therapy is really when you think about your thoughts and behaviors in order to be able to make changes to your behaviors and your feelings about how you go about something or do something. So say I feel bad about being late to work every day, right? Pre-COVID, right? We went to work.
When we could actually go outside and go to work instead of
when
just
we actually physically had to go somewhere else. So, and I come to my therapist and say, oh, I wish I wouldn't be late for work anymore. We do some exploration and talk about this. And really, it starts out with me coming up with some sort of plan, right? Okay, let me think about my problem when I get home. Tomorrow, I don't want to be late for work, so I'm going to make sure I set my alarm maybe 5 or 10 minutes earlier. And when I hit that alarm, I'm going to really try to be thoughtful about getting up and being on time. So this is kind of a really broad gist of how cognitive behavioral therapy works. But if you think about it, one of the words that I didn't say there on purpose was really about being mindful, right? So cognitive behavioral therapy, it doesn't explicitly say this, but it does incorporate a lot of what we today call mindfulness, which fits under the umbrella of energy psychology. Incidentally, mindfulness is being taught as an intervention in traditional graduate schools now, even in counseling programs. I know that was my discipline. So the idea of how thoughts and behaviors can change feelings. So, right, if I come to the therapist with that issue, it's probably causing me stress that I'm late because I have these consequences from it. So as I change my behavior, I'm on time, I feel better because I'm not late. So the thoughts and the feelings with cognitive behavioral therapy, are assumed to somehow go hand in hand at some point. What I do with the kids with autism spectrum disorders is mostly under the umbrella of applied behavioral analysis, or ABA. And this is the most well-researched intervention umbrella of techniques for this population of those diagnosed with spectrum disorders. There's thousands of peer-reviewed studies. This is solid for this population. ABA is very, very simple in the premise of what that theory is. It's basically that there's a behavior that happens, and then something happens before the behavior and something happens after the behavior. And like I learned early on in my practice of ABA, it's behavior is the dead man's test. If a dead man can do it, then it's not behavior. So everything we do is behavior. And if we think of the things that prompt the behavior or come right before it, and then the things that happen afterwards, those are integral to us changing a behavior or helping someone change a behavior. So it's somewhat similar under the same family as sort of cognitive behavioral therapy is in some ways. But energy psychology techniques really add, I think, or are a piece of both of these therapies. I don't know that they're formally acknowledged to be a part of each of these therapies. But as I mentioned in CBT, really what we're doing is implementing mindfulness. When we're thinking about our thoughts, we're thinking about how our thoughts are connected to feelings. Really, that's thinking about our thinking. And that's mindfulness and awareness and preparation for considering all of those thoughts and feelings together. Under the umbrella of ABA, I always say that there's an art to practicing ABA. There's a science and there's certain protocols you have to follow, but there's also an art to this. A big piece of that art for me incorporates energy psychology techniques. When I look at people who are really good behavior therapists, chances are they have great mindfulness, which can incorporate some anticipatory thought, like if and then type thinking, right? If I do this, I have the possibility for this outcome or this outcome, let me be prepared. So that type of awareness and thinking, again, falls under the umbrella of energy psychology. Now, energy psychology can span a lot of different things. If you Google it, you know, you can, or YouTube it, you can probably see a lot of EFT, which are emotional freedom techniques, and tapping. This is probably one of the most common techniques. This is a specific technique that takes training and, you know, lots of practice to be able to use effectively, despite some of the overgeneralized uses that are promoted on the internet, that it's very simple, it looks very simple, but people are not widgets, right? So when we start tapping into human thoughts, behaviors, and energetics, we can't really predict what's going to come out. And anybody that's watching that does therapy or has had another interaction with a human being at any point has realized that not everything is completely predictable. So again, this goes back to the art piece of therapy in general, whether you're using ABA or CBT or energy psychology techniques, but also, you know, how complicated that some of these practices can be under the umbrella of energy psychology techniques. Some people will even classify some things under energy psychology that, without, at the risk of sounding offensive, some might consider woo-woo. Now, I know that that word, and why I'm saying that is some people actually take offense to that word, and I don't mean to be offensive, but to describe the techniques in a way that people might understand, perhaps alternatively might be described as not well researched, experimental,
on the fringe of the alternative.
On the fringe of the alternative.
Yeah.
So when I practice these techniques, I like to stay, in my clinical practice, I like to stay on the conservative end of the spectrum with energy psychology and stick to the things that are well researched and that I can explain in a tangible way to people. One of the interesting things that I've seen through the years of my practice is back in the day when I first learned to do energy psychology, people really, of course, haven't heard of these at all. Even today, it's kind of like, oh, I'm not sure I heard of that, but it was way less common 20 years ago. And it was more difficult, in my experience, for people to understand what was happening when we were using these techniques, because shifts would happen with sometimes out a lot of conversation. And this is not an altered state of consciousness or hypnosis I'm not talking about, but just some of these basic techniques. And so people sometimes would leave feeling better, but really puzzled about why they felt better. And it's interesting moving forward today that I tend to work with a lot of millennials in my practice. And I find, again, through my experience, one of the best things is they don't question it a whole lot. And I don't know if that's just generational. I don't know if it's that the practices are a little bit more mainstream now, but they're kind of like, hey, whatever works, whatever, however it works is really cool. And with some of the meridian techniques or the tapping techniques, the truth is we actually don't know why those mechanisms work, but we do have enough research to show that there are shifts that happen and people do feel better.
Yeah. Surprisingly, I've had a little experience with EFT, working with some clients that have done it. And I actually did a session and I was really surprised. You feel a little strange tapping the places the first time, but it was to me, it was that process, and it was the starting at one place and unwinding and bringing that awareness, and not only the awareness, but the definition of what the issue was. And to me, it was effective really quickly. And how you described it, I felt better, and I'm like, well, that just happened. And it wasn't without all the talk and the analysis, but it did set it in. Something you mentioned with CBT and also the ABA, where there's an action, or call it a trigger, there's a behavior, and then there's an outcome. With the use of these, I love that you said the words mindful and awareness, because that came up to me. I'm like, oh, that's what you're speaking about. Those are the words I understand. So if there's a mindfulness or an awareness of a pattern, it feels like there's creating space in between the trigger, if you will, and the behavior to allow the mind to catch up or decisions to be altered. Is that accurate in what you're doing?
I think that it's different for each person where their awareness, so to speak, is with what that trigger or antecedent is or may be. And to be honest, those are the people that will come to therapy and are the most stuck. So if you think about that from a common sense perspective, I get this a lot when I work with parents of kids with any type of emotional or behavioral challenges, that if it's a single function, as I call it, I'm not going to get too much in detail about functions and behaviors today, but if it's a single function behavior, like if, oh, I can see what the antecedent is. It's really clear to me that when I give Johnny peas, he spits them out. I know he doesn't like peas. When it's a crystal clear sort of linear way, not much space is actually needed for that type of intervention. It's when it becomes a little bit more complicated and then the antecedent isn't real clear. And this is where energy psychology techniques and the beauty of even using EFT or thought field therapy, the meridian techniques, really help in addressing these things. I mean, it is so common when adults come into treatment with me and say, I can't get past this problem. I don't know what it is. My logical mind says that this should be done, or right? It's just some sort of block. And again, this is where, from a CBT standpoint, we can talk this out and talk it out and fatigue it over many sessions, and we still might be kind of coming, around in circles, where when we implement tapping per se, or EFT or thought field therapy, what we do is we're going in the body. And so the thing that I didn't mention about energy psychology techniques and what makes them common is that we really are looking at the mind and the body connectedness, and how the body stores information from the mind. And it doesn't necessarily feel so good, or we can feel really good if it stores and encodes it in a great way. But these disturbances sort of in the body, if I have someone who comes into me with this idea of, I can't shake this problem, I've tried these rational things, the second that I say to them, okay, when you think about that problem, where do you feel it in your body? They'll say, oh, is in my stomach, in my chest. It's just my thoughts are racing. I can't remember a time when I had a client present to me that way, when I've asked them where they felt it in their body and they can't answer. So even people who have difficulty, what we call getting in their body or feeling it, at the least, they might say that their thoughts just keep, circling and circling over it. So that's I'll take it. That's a start of feeling, being in your body. And so when we get down to the nitty-gritty of how that information was stored, and when we address that through these techniques, it's kind of like this awe moment where, that layer of block that, I've felt has been there forever, I just couldn't shake it, is released. And so this is really what is so progressive about these techniques when they're used really well, and you've mastered the art of using them with people and clients, that it's much more rapid relief than traditional techniques. So what kind of happens is that, we extinguish the disturbance in the body related to the problem, and then the thoughts and feelings shift about the problem, but it almost seems magical in a way, because it's like, if you've experienced it, it's like, how did that happen? I'm not consciously connecting that feeling with, okay, now the feeling's gone, I can think about it this way. It doesn't happen that logically. It just, something in the body feels different, feels shifted, and I can implement my rational mind to really gain clarity or perspective about how I feel about the problem.
Right. I forget which book it was. There was an audio book, and I am a big believer and supporter of the mind-body connection and how the body does store memories and trauma. And they did this study, and in a nutshell, basically what it was is they asked people to guess which card would be turned up or which color. And they measured all the body responses, and then they measured the mental response. And what they found out was that the body was like 60% more effective at prediction, and it took like a tenth the time that the mind actually did. That there is an intelligence within the body, and there is the capability to store those memories or those feelings. So you're speaking quite a bit from a clinical diagnosis where there's autism spectrum, or there's other clinically diagnosed. The same can be said, I'm assuming, for traumas or early life things. Another part of the book that came up that was really interesting was a study of a young girl who was an A student, and she got like a 97. It was her first not perfect one. And she got so upset by it, and it created this reaction. And that behavior then became, she didn't want to fail, or the fear of failure. So she either became a perfectionist or did nothing. And those little things are, I see it a lot. And I'm learning that for myself. Like, how does it get stored in the body? How is it introduced, whether it be medically or psychologically or emotionally?
Yeah, I think that's probably the $1 million question. How exactly does it get embedded? Part of the thing that I find fascinating about my work and what I love to do with clients is help them be that detective. It's not always important why, when, or how that message got stored. For some people, it really is. Other people, like I mentioned earlier, are like, yeah, I don't care. Let's just get rid of it. I don't want it anymore. And so it's not always necessary when we're doing energy psychology techniques to have the conscious awareness of all of those, suggestions that you just asked about. In other types of therapeutic techniques and modalities, that's kind of the premise about bringing that to conscious and make sure that we understand it and can process it in more, sort of a cognitive, emotional way. So that's the beauty of energy psychology. I haven't seen really adverse effects from doing it that way. When people say, I don't really care, I just want to extinguish it. Okay, if that's your truth and that's your perspective, which I'm really big about perspective and individuality, of course, in therapy, let's go with it. If it comes back later and then you want to talk about it again, great. But I have a physician I work with. He's an MD. He's excellent. He's been in the field for many, many years. And he always says, kind of one of the best things that you can do with pain, especially, is like, well, if you don't ever focus on it, that's probably better than worrying about it and being mindful about it, right? And bringing more attention to it. And I say, I kind of say the same thing about when we look at how we think about the mind and the body connection under the guise of energy psychology and worry, for example. So we say, the more that you worry, the brain encodes that pattern, and the better that your brain gets at worrying.
Right.
We probably don't want that, but that again, that's an energetic sort of embedded core belief, so to speak, that is pretty extinguishable if you have a good skill set as a clinician to help someone start to rewire that pattern.
I like what you said there. That's essentially the old joke. Guy goes into a doctor, says it hurts when I do this. He says, don't do that. Right? Yeah.
Right.
Just don't do that. So we've focused a lot on the autism spectrum and some of the energy techniques. And I know that's your area of specialty, but the energy psychology techniques, they're applicable for a broader range of diagnoses and maladies, correct?
Mm-hmm. Yeah, and maybe I should have prefaced this a little bit better, but I have been speaking more so to other clinical disorders. Let me be completely transparent that there is no research to date to show of efficacy of energy psychology disorders for the direct treatment of autism spectrum disorders. However, a lot of kids, young adults who are diagnosed with autism spectrum disorders do tend to experience a lot of secondary or multiple diagnoses, so to speak, where there's anxiety, where there's clinical levels of anxiety, or there might be depression, or there might be a perceived or trauma, where these are the areas where the energy psychology techniques do have a lot of research. I will say in my experience, I get this question all the time, why aren't we using these with kids that are diagnosed with spectrum disorders? And one of the things that it's kind of difficult for a lot of people with this diagnosis, not everybody, because I was talking a bell curve, right? This does not apply. I'm not an all or nothing kind of person when I speak clinically, but a lot of young people in this population have that difficulty of making the connection about the problem and feeling bad in the body. And why I think that that's difficult for a lot of people who are diagnosed with autism spectrum disorders really comes down to executive functioning and the way that their brain is wired. We do know from the research that there are neurological differences in those who are diagnosed with autism spectrum disorders. So it stands to reason that information that goes into the brain and body with this population may be interpreted a little bit differently than a person whose brain is not structurally different than a person, or is structurally different than a person who's diagnosed with a spectrum disorder. So from a sensory aspect, even if we start to tap, is this sort of a direct message like we make the assumption it might be with a person who does not have that neurotype in their brain. So it's a little tricky. I do use a disclaimer, and I talk to parents and young people about this, that there's really no research, and some people are like, let's try it anyway. So some of the people I work with feel like some of the tapping modalities, for example, are effective, and I'll take it. Again, it's about the person's perception. If they feel like it helps, then fine, right? If I say don't do this, right, and I say okay, I won't do that, and they say everything's fine, I don't have to, I just don't do that, it's great. Okay, if that's your choice and that makes you feel better, then fine.
Right.
I'm hesitant to use these techniques with this population right from the start. I think there are a lot of different tools under the ABA guise to be able to help those diagnosed with autism spectrum disorders function a little bit more appropriately. Oftentimes with this population too, it's kind of, I will say parents think that this is problematic, and I think I actually did a YouTube video on this, but whose problem really is it when the identified person with the autism spectrum disorder doesn't seem to think that they have a problem, maybe when it comes to socialization? They're quite content with the way that they're interacting with people, right. Although the parents might be able to see that they're not getting the response that the parents think they should be getting, or they feel bad about the interaction. So oftentimes to even identify a problem is very externalized for this population. You know, this isn't my problem. If the world was different, then it would be fine. The world needs to adjust to me, you know, which is an interesting way to look at the world. But again, examining executive functioning in this population as much as I have, it makes complete sense to me that that's the way that their brain is working. It doesn't have anything to do with emotional attachment or the lack of to another person. It's really their mechanism about how they perceive the world and their role in it.
Mm-hmm.
So one of the things that I think is pretty beautiful about this is it's really a teaching point for a lot of people who have not experienced this. So even for parents who might have their first child diagnosed with an autism spectrum disorder and don't have a lot of experience with this, you know, when I say to them, you know, if this might be painful for you to watch, but if they think it's great in their world, like maybe we should take some lessons from that on some level. Why are we so emotionally distressed by these things that, you know, we can make the choice not to perpetuate? Why do we perpetuate them, right? That's our emotional mind and some of our social needs that, you know, have been conditioned either by society or by our own beliefs that we have to continue to maintain, even though it's not feeling great for us. So it's really interesting how, you know, the diagnosis of this disorder has evolved and has become more widely known about, and what we can really glean from examining these people and these individuals about how they think. There are so many beautiful aspects of it.
Really. And for, you mentioned parents, and I don't think any parent would be, I can't imagine my son's healthy, but any parent with a child diagnosed with autism presents a whole different manner of raising a child, and no one's really educated. There's no education towards that. And along that line, I know one of the exciting projects that you're working on at this time is a new book, and I'm going to try and get the title right so you can correct me, but From Exhausted to Energized, the Autism Spectrum Disorder Caregiver's Guide. So this, I think, is a book that is radically needed for a lot. I know there's a lot of autism support groups here, but this is taking your 20-some years of experience. And how did the idea of the book come? You know, where's it at? What do you hope to do and present in this book that's coming up?
Yeah, I love to talk about the idea of how this came about, because again, this comes back from staff and parents teaching me, and just me being able to conceptualize what they were telling me and what their struggles were, and for me to be able to give some solutions to this. I think I probably started to think about the idea of doing this when I worked at the Autism Center with that hospital system under the affiliation agreement with the Cleveland Clinic. And let me just be clear again, this was a pure ABA program. I was not doing any energy psychology interventions with the kids. Mindfulness, yes, but that was paying attention, you know, as we kind of viewed it there. And that was more with the staff. So one day I had staff there that were phenomenal, and these staff wanted to do this job with all of their being. This was not something that was just a paycheck for them for the most part. So I was really fortunate with that. But I had cameras in my office, and after the program was over and the kids left, you know, the staff would be together in groups and doing their paperwork. And one day I turned around and I saw them, and there was like these body language cues to me, of course, being a behaviorist and reading body language, right? That looked to me like frustration, upset, you know, discomfort, those types of things. And mind you, I mean, these staff were phenomenal at their job. I mean, they were flawless at what they were doing, which is, if you really know ABA, that's really hard to accomplish. So I kind of said to them, hey, is everything okay? And they're like, everything's great. And so their performance was great. So I'm like, okay, everything's good. So a few days later, I asked again, and finally, okay, you know, they kind of fessed up, and they said, you know, we love what we're doing, and we're doing well throughout the day, but I'm going home and I'm feeling drained and exhausted and taking this out on my significant other or my kids or whoever, and I just don't have the energy to do the things that I like to. So I said to them, okay, you know that I've practiced these techniques before. Do you want to sort of see if I can put something together to help you. And they said, sure. So they volunteered. It was a voluntary study that I did. And there were, of course, many things that could be improved about the study. But the point was, is I gave them one exercise to do a few minutes a day, like a couple times a day. And I let them do it on work time when they were away from the kids, of course. And I rated their quality of life. And I think that it was an 8-week study. So I rated the quality of life before the intervention, pre-intervention, and then post. And what I found in all the participants is that some quality of their life improved after, just from my knowledge, just this one intervention. Now, of course, the other variables about what was happening in each of their lives was not under my control at that point. So I felt like I might be onto something with this. And the more that we, after the study was over, the more that in supervisions, we talked about this process for them and what they felt like, they started to get really good at knowing before they would start to get to the stress level or go down that rabbit hole, so to speak, while they were at work, which again, extremely impressive when it comes to mindfulness, when you're implementing a structured ABA program all day. To do this type of program, let me just give everybody an idea. The idea of being present and staying mindful for 6.5 hours a day is an understatement when you're running this kind of program. You cannot be focused on anything else. There's not downtime when you're one-on-one with these kids in this type of center. This is 100% focus. So the fact that they started to be able to say, uh-oh, my focus is going just a little bit, come back. That's what they learned from doing this exercise. They learned what their baseline was for feeling calm, centered, and relaxed, so to speak, when they started to just inch up a little bit. And then they called it flipping the switch. They would just say, okay, mind, flip, and just go back to what I'm doing, which is incredibly difficult for people to just do. So I thought, why am I going to limit this to my staff? This seems like this would be the ultimate for parents and caregivers, because there is a difference in parenting kids with autism spectrum disorders. The behaviors that a lot of these kids exhibit, we're looking at high risks of safety behaviors. We're looking at really fast moving kids, really fast. And it's kind of like these behaviors that happen like still, fast, still, fast. So if you can imagine what your reaction has to be like all day long to sort of keep up and keep a kid safe that exhibits those types of behaviors, you have to be on your toes.
Well,
So,
one thing, if I could jump in here, the one thing you said that really struck home with me, and I just want to pull out a little bit, is the concept of baselining. A lot of people, and self included, until I learned where my baseline should be on that calm centered thing, being, it's down here, it feels good. For me, it's when I'm out in nature and I'm in trees, I'm calm and connected. But in daily life, or if you don't have the chance to do those mindfulness activities or experience to it, it seems like your baseline starts to escalate. And I would imagine for, parents and caregivers, their baseline is probably pretty elevated to be on guard, to, be ready to react when those things happen. So, the concept of baselining really seems to be important and help these parents identify that, hey, your baseline might be slightly or extraordinarily elevated. How do you bring that back?
You're right on. And it's even, let's take that back up a step further, that really the baseline for that individual parent, even before they had the child, was their baseline already starting to creep up. And again, I talk about this in other videos, that just the pace of life and how lifestyles have changed and time management, and we're just, moving faster and faster and faster. That in itself lends to that creeping up baseline. So you add, your baseline maybe should be here for you. You feel like you're here, and then, you're parenting, you're starting to parent a special needs child, and it's, really far elevated, and we don't even know what our baseline is. And interestingly enough that you say that, because that is what I hear from parents that I work with now, that I didn't realize how up I was until I started doing some of these techniques. And I realized they're telling me that I was probably up here before I was a parent and didn't realize what this feeling felt like, to be centered, to be calm, to be relaxed. And this is where, without getting too technical just in this short talk today, but this is where polyvagal theory comes in, and this is integral to why we think that the energy psychology techniques work, especially the tapping. And polyvagal theory, again, grossly oversimplified, but has to do with our fight, flight, and freeze mechanisms. And these mechanisms served us well for a time. They were developed in our primal brains, right, to keep us safe and to survive. But our brain gets confused, and sometimes what we see today are survival threats aren't necessarily threats to our physical safety, but they can be to our emotional safety. So oftentimes we're staying in fight, flight, or freeze, which works to a certain point, and this is what I talk about with peak performers also. It's helpful to a certain point, but then it starts to be detrimental when it crosses like a certain line or threshold, and that's different for everybody. And it keeps us either feeling wired, feeling like we can't come down, running in circles, either withdrawn, so these overactivated states in an unhealthy way can manifest oftentimes as what I see clinical mental health issues as being. So again, coming back to energy psychology techniques, these are great tools to help a person be able to manage those states better, to be able to function more effectively in their daily life, whatever it is, but especially for these parents.
Yeah. And that fight, flight or flight, you're right. When it was created in us, as we evolved with it, it was a spike when the tiger or the whatever is trying to eat you, and then it came back down. But daily life, and through my experience and growing up, having businesses always, it never came back down. So it's elevating the cortisol. There's all other associated health risks. We talked earlier about having it set in the body. Well, your body's haywire, so it's going to remember that. So these techniques are phenomenal that you're able to share with the parents, but they're also applicable for everyone. Like you said with the millennials, like let's get our children and our friends started out earlier to realize, how do we recognize, how do we reset and level back to the appropriate baseline? Because from there, you're mentally clearer, you're able to function properly and be restored. So I would imagine those are absolutely critical and well received gifts by the folks you're working with.
Yeah, they really are incredible, which, people will ask me all the time, like, do you do this stuff? Which leads me to another point about lifestyle and wellness. And really, energy psychology, in my mind, is more of a mindset and a lifestyle. And I firmly believe if you're practicing as a clinician or as a coach or a nurse, energy psychology techniques with patients, that it's imperative that you're doing your own self-care. And that can look like using certain tools every day. But again, to me, it's a mindset. And I've just been fortunate enough to be introduced to this type of mindset really early on in my life. And people will just say, how are you? One of the things I get a lot, to be honest, is how resilient I am as a therapist for as long as I've been doing this. I remember I was probably 5 years into my career, and I had one of the owners of a company that I work with said, you better be careful, you better slow down or you're going to burn yourself out. And like, I just wish I could see her today, to say, and I'm not, but statistically, there is high burnout rates, amongst clinical practitioners, whether it's psychiatrists or, therapists, and people just, will leave the field. And this is kind of, let me circle back to what I said earlier on about why I encourage outpatient therapists to be brave and start to learn a little bit more about treating caregivers of those diagnosed with spectrum disorders, because this is another niche that does create high burnout. ABA therapists, people that work with autism spectrum disorders, energetically, this takes a toll on a person, as a parent will tell you. And so I really, another one of my missions is to kind of spread the word about energy psychology to these caregivers, these allied caregivers who are teachers, who are therapists, who find something, if at least it isn't a lifestyle yet, but some of these quick tools that they can use daily to be effectiveness. Because, right, if we don't put our oxygen masks on first, we're completely ineffective for everyone else.
Right.
So, and it does really involve, daily practice and mindfulness about your lifestyle choices, I think. People will come to me all the time about those types of things in therapy. Like, I don't feel good about this, I don't feel good about that. But it really comes down to daily life choices. I'm either, waking up too late and I'm late for work, which starts a whole chain of events. And then I'm rushed for lunch, and then I go grab something that's not good for me. And then I'm too tired when I get home, and then I don't exercise, right? There's something to be said for these traditional recommendations, along any therapeutic lines about just what a generally good lifestyle is. And the fast-paced lifestyle that most of us are under doesn't lend to that easily anymore. So it does take some effort to get back to that, but a little bit of effort in the short run and early on in one's life can go a long way in, lifelong healthy practices.
Yeah, absolutely. And, I'm really grateful for the morning rituals I have. And you're right, it is something as simple as taking 20 minutes or doing breathing exercises or yoga or whatever it is in the morning to set your mind, reset it in baseline. You're so much better for the day, and things do come up. Now, this book, it's coming out. Give us a little bit of just idea when we can expect it. Then I want to touch a little bit and expand it to the work you've done with peak performance. We've talked a lot about autism and health, but you also use these to help people perform.
Yeah, hopefully 6 to 8 months. This is a new experience for me. So I'm working with an editor and a pitcher, and people are showing interest on the publisher end now. So I can't tell you exactly when it will be out, but as soon as possible. Most of the content is there on my end because I've been teaching this for a lot of years, and that's actually what prompted me to put it all together. I've been teaching it for a long time, and I thought, well, hey, why don't I be able to get this, together and be able to be available for the masses, because this has helped so many people. I know people, when they write things, they're really passionate about what their message is, but I've seen such significant difference in caregivers, especially parents, that this is, in my opinion, really imperative that they have these tools. And just like you said about lifestyle choices and integrating ritual practices, one of the things that I found when I was doing research for this book with existing strategies and recommendations out there was that a lot of these things are time consuming. And the things that I do hear from these parents is like, yeah, I don't have 20 minutes in the morning. I don't. I maybe have a minute. And so I've tweaked these exercises down to literally minutes a day. And I work with families to figure out when they can do them and when that'll work. Because it doesn't help for me to say, do this, this, and this, and someone walks away and says, I can't fit it in. That's completely ineffective. So part of giving these suggestions and these tools is employing my ABA background into a commitment to when can we get this to work, and is this doable for you, and let's make it doable for you. So when we talk about peak performance, really I see this as just a continuum of what I'm doing already, but it applies so well to athletes, to high functioning people in business and CEOs. Whatever you're doing, whatever field you're in, if you want to be better, I can see that as peak performance, right? Because we just want to get better. One of the cliches I think about therapy that is a huge misconception is that we have to be in the hole to start therapy. And then when we dig ourselves out of the hole and get back to a semi-baseline, then we're good to go. And I've heard this from clients too, where they've been discharged from therapy with therapists and said, okay, now what? Now I kind of don't have this problem anymore. Now how do I function? So therapy is so much more than just digging yourself out of the hole. It's about self-improvement and self-growth and who you want to be. Are you the best you that you want to be? And if not, let's shift the focus into peak performance. And that can be, again, whatever that means for you. For athletes specifically, this is a specific niche that I do have a good deal of my client base within. There are so many things specific to that high performance where you want to talk about teetering and mastering this fight, flight, and freeze and staying right on that cusp of being too much and just enough. Like, this is a population who really has to master that. And when one little thing changes or happen, say an injury, say something in their personal life that's stressful, when this blows out, it is like the body can interpret that as almost a life or death situation. And go back to what I said about fight, flight, and freeze, right? So we're like, and we have to survive, and coping mechanisms sometimes go amok. The other interesting thing with athletes is most of them, not all, but a lot of them throughout their life have used their sport as their coping mechanism. So when there's a block or barrier within their sport, and it can no longer be an effective coping mechanism, that's when a lot of these stresses can happen too. So there's so many layers of this to peak performance, and especially with athletes amongst a variety of sports. And what I don't claim to be as an expert in these sports, and I don't necessarily need to be, because again, going back to individual treatment, I want that specific athlete to tell me what they perceive their specific issue is. I might need a little bit more information about the technical pieces that they feel like they're not as performing as well at anymore. But as far as their individual, how it's embedded, what got embedded, how it did, that's the conversation that I learned through working with them and getting to know them.
Well, that is wonderful. And Mandi, we'll close it down here a little bit, and I'll put, if anyone's interested in getting in touch with you, it'll be here on the video or in the links below. But just kind of closing words for anyone who might be considering energy therapy or be motivated by what you've said today, any words of encouragement or direction for them?
Yeah, I would definitely say that if you want to have a first experience with energy psychology techniques, I would say rather than try to get it online, if you can, is to seek out a therapist or someone who's very well trained in any of these techniques, and people will say where to start. You can look at my website, and I think I have links embedded in the site to where the research is and things that you can explore yourself. But hands down, working with a trained professional as your first experience will give you the most bang for your buck, literally, and you'll really understand how cool this stuff is rather than trying to go about it yourself. A lot of people that are practicing these techniques, if they're licensed clinicians, likely it would be covered under your health insurance. You would have to check with that specific clinician, but there are ways to get it covered, especially if you're experiencing a clinical mental health issue. So I would say seek a practitioner, reach out, and have a direct experience with it. I can only talk about it so much, but you really just have to experience it yourself.
As most things in life, it is the experiencing. So, Mandi, thank you for your time today. It was great to catch up. I love what you're doing. Best wishes on the book. Again, if you've enjoyed what Mandi had to say, please check out her site. It's in the link below. And, have a wonderful day, and I'll be talking to you again soon, I'm sure.
Thanks for having me. It was great.
All right. Take care.
See ya.
Thank you for watching. If you liked what you saw, be sure to hit that like and subscribe button right now. Stay tuned and check out the channel for other interesting and informative videos.